I have selected auscultation of carotid arteries for bruits as a skill I'm going to perform on a patient. The reason I've selected this skill is because it provides rapid, non-invasive way to screen for significant carotid artery disease, which may be present in patients with vascular risk factors or concerning neurological symptoms. Auscultating for carotid bruits allows clinicians to detect abnormal sounds produced by turbulent blood flow, which is often due to underlying atherosclerotic narrowing or stenosis in the carotid arteries. This detection is clinically significant because carotid stenosis can increase the risk of ischemic stroke, one of the leading causes of morbidity and mortality worldwide, according to Bauer. This skill is particularly relevant to the scenario of this 40-year-old female patient presenting with a new severe headache and markedly elevated blood pressure reading 190/102. While she does not have prior significant health history, her family history is notable for hypertension and hypercholesterolemia, both of which are established risk factors for vascular disease. This acute onset of headache with associated symptoms like photophobia and nausea, coupled with severe hypertension, raises concerns for a possible secondary cause of headache or complications related to cerebral vascular disease, according to the American Heart Association. Auscultating the carotid arteries therefore becomes a valuable part of the assessment. The information that can be obtained from performing this skill as it relates to the patient scenario includes the presence or absence of the carotid bruit. Detecting a bruit would provide evidence of turbulent blood flow, which often indicates underlying carotid artery stenosis or atherosclerotic plaque. According to Wang, the presence of carotid bruit in this patient, who has both genetic predisposition and current clinical risk factors, would heighten the suspicion for carotid artery disease as a contributing factor to her symptoms. This could prompt further evaluation, such as carotid ultrasound imaging, to determine the degree of stenosis and help guide management, including blood pressure control, and a possible referral to a vascular specialist, according to Sacco. Conversely, the absence of a bruit does not entirely exclude significant carotid disease. Studies show patients with even advanced carotid stenosis may not have audible bruit, emphasizing the importance of comprehensive clinical evaluation and the use of additional diagnostic tools when indicated, as noted in Bauer and Wang. Nevertheless, auscultation remains a valuable bedside skill that can yield important clues, especially in patients with risk factors and symptoms suggestive of vascular involvement. Additionally, incorporating this skill into the assessment reinforces the importance of thorough cardiovascular evaluation in patients presenting with hypertensive crisis or new onset of neurological symptoms. By listening for carotid bruits, clinicians are reminded to consider not only the immediate causes of the headache, but the broader context of the vascular health and stroke prevention, per Sacco. Early detection and intervention for carotid artery disease can help prevent future complications and improve patient outcomes, as well as provide reassurance or guidance to the patient regarding necessary follow-up care. In summary, auscultating for carotid bruits is an essential component of the physical examination for patients like this one, where vascular risk factors and acute symptoms converge. This skill offers immediate, actionable information that can inform further workup and intervention, thereby supporting optimal patient care and safety. Okay, so first I'm going to enter the room, wash my hands, ensure patient privacy. Hello, my name is Amber. I'll be performing the part of your physical examination today. I'd like to listen to the blood flow in your neck, which helps us assess for health of the arteries that supply blood to your brain. This routine and painless part of the assessment. Do you have any questions before we begin?
No, and I consent.
I'm going to have you sit up and relax. Please look straight ahead and then gently turn your head a little to the left. This helps me assess the artery on the right side of your neck. Let me know if you feel any discomfort. Before I listen, I'm going to gently feel a pulse in your neck. I'll do this one side at a time, and you may feel some light pressure. Okay, turn your head this way. I'm going to place the diaphragm of the stethoscope over the carotid artery. Please take a normal breath and hold it in for just a few seconds. Now we'll do the same thing on the other side. Now take a breath and hold it. Okay, breathe out. Okay, and we will follow up with the results of your procedure. Okay, so the relevance for the American Heart Association is the source provides a comprehensive overview of carotid artery disease, including risk factors, clinical presentation, and the importance of early detection. The relevance of the Bauer reference is a peer-reviewed article that investigates diagnostic values of carotid bruits for identifying underlying vascular pathologies such as carotid artery stenosis. And the relevance of the SACO reference. It's authored by the leading stroke experts, outline best practices for assessment and management of patients with carotid artery stenosis. And the relevance of Wang, this article reviews the practicality and effectiveness of carotid auscultation in modern clinical environments. It notes that auscultation remains a valuable bedside skill for preliminary assessment of carotid artery health, especially in symptomatic or high-risk patients.